our topic of the day. So one of the fun parts about being a child and adult psychiatrist is we get to tie everything together. And so today's topic is going to be, is this medical? Okay, and we called it that today because in order to be a psychiatrist, you have to be a really good medical doctor. And this is where I'm going to toot my profession. No, my profession as a physician. I'm going to toot my specialties horn, which is, yeah, we have to know all of medicine because if there's a medical reason why something is showing up and looks like mental health, we need to be able to treat the medical reason. And so, in other words, we need to be really proficient, if not an expert in the medical stuff. And then we overlay all the mental health training that we get on top of all the medical. So we need to know like two bodies of information. So let me give you an example. For people who have an overactive thyroid, sometimes they can come in and they will feel very flushed. They will speak really quickly. They get agitated really easily. Sometimes they see and hear things. And if you're not careful, if you're only seeing things through a mental health lens, you may go, oh my gosh, you know, is that schizophrenia? Is that a panic attack? And if we're not thinking about, wait a minute, let me get the rest of the history, let me look at the lab work, and let me rule out all the medical stuff. Let us get a list of the medical stuff. If we're not thinking that, then we can miss things. And so, is it medical? We always ask that question. That's actually part of our what do you call it? That's our routine. That's our modus operandi, our MO as psychiatrists is we are constantly, I covered my microphone. Sorry. We're constantly ruling out medical stuff. So when you come in the door, I'm paying attention to how you walk because there's certain diagnoses, neurological conditions that I can guess at depending on how you're walking, because some of those neurological diagnoses can look like psychiatric diagnoses, right? So you're walking down the hallway, I'm paying attention to that. I know this sounds weird, but literally what you smell like when you come in, we pay attention to that, because if you are walking and stumbling and you walk by me and I smell alcohol, that's a medical reason. Maybe you're intoxicated, or cigarette smoke. We know that cigarettes, if you smoke while you're pregnant, your kiddo has a higher risk of ADHD, right? And so, and this is thumbs up for, I should say, point my fingers up, not thumbs up, because if you're smoking, you shouldn't be smoking. And there's a whole way that we can treat you for that, because that's also medical and that can also affect your mental health, right? So, I'm paying attention to, literally what you smell like when you come into the office. When you sit down, I pay attention to how you sit, because if you have trouble, doing certain things like sitting still, if your leg is jumping, if you're moving around, if you have movements without trying, all of those things can let me know that there's a medical concern going on. Of course, we always get your height, weight, and blood pressure, because those are other ways that we can see if there's a medical issue going on. We get a really big history. So we ask y'all a gabillion questions, partly to make sure that we're running through our list of mental health things, but also we're running through our secret list of medical things, because if your blood sugar is off, if you have diabetes, HIV, if your cholesterol is bad, all of these things play a role in your mental health if they're uncontrolled or unaddressed. And so, is it medical? Absolutely. And then that's just like the standard stuff, y'all. That's like literally the standard stuff that we do at any point, especially when we first meet you. Well, then there are all the one-offs, right? So sometimes you come in and you're like, hey, I can't smell anything, and my taste buds are off, and I just lost 5 pounds. And you're like, well, I mean, could that be depression? Because again, depression can make you lose weight. Or could it be COVID? Because COVID destroys your olfactory nerves, or infects them, which is your smell sensing nerves in your nose, right? And we need to be able to identify if it's COVID or not. Maybe it's just sinusitis and like chronic sinus inflammation, and get you to that right place. One of the biggest ones is sleep apnea. So people who snore at nighttime, where their soft palate, that soft part in the back of your throat, when you fall asleep, it like collapses and you get the that thing. Yeah, that's super common, especially in people. And one of the hiccups with sleep apnea is that if you don't sleep very well, your mood is bad the next day. Wah, 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 right? And so, yeah. So, is it medical? Absolutely, absolutely, it could be. And so, we have to be very thoughtful about those things. Are we perfect? Of course not, because I think it's in one of the other video clips that I remind you that physicians are educated guessers. Okay, we are not gods. We don't walk on water, even though some people act like they do. We are educated guessers. We're just really good at it. Like we guess correctly more often than any other like medical profession. But that doesn't mean that we're better people. It just means that we're better guessers than most folks. But we still make mistakes, and sometimes I miss things, or I misread things or misinterpret things, and that's just kind of part and parcel of us trying to be better at what we do, and so that we can do the best that we can. And then, like I said, at the top of this topic, the body of information in the medical world is just so vast, and it grows every single day. And so we do our best to keep up with those things through continuing education and continuing medical education. But yeah, the key is be patient with your doctor. We're trying to train doctors to be more patient with themselves, and to give you more time to be able to tell your story, and for us to listen and try to figure out how we can best help you. But just know that is it medical? It very well could be. And so the key is the more information, the more succinct you can give that information, the better off you're going to be. So there's lots of advice out there that says, before you see your doctor, go through and like bullet point the things you want to cover. And depending on what doctor you go to, sometimes they may not have time for all of them, but at least you've gathered your thoughts. I think that's incredibly powerful, especially if you're in a fast appointment setting where you have like 10 or 15 minutes. By all means, yes, bullet point them. I love when people come into my office. So as a psychiatrist, I spend 60 minutes with adults and 90 minutes with kids and families. And I love when they come in and they go, hey, I got my book, and they just read what they're saying. I think it's great because as they're reading, I'm taking bits and pieces of that data and then overlaying that with all the medical stuff that I've seen and heard to build a robust picture of who that person is. And so, yes, the key is medical history, and medical is super important. Your psychiatrist is literally trained to be a phenomenal medical doctor. We can even save your life, y'all. Did you know that? Yeah, go us. I'm gonna pat myself on the back for that one. Yeah, so we can even do that if we need to. However, if there's an ER doctor standing right beside me, I'm totally gonna let them do most of the work because you know how that is. But yeah, so we are medical doctors. We enjoy working with you, and we want you to know that one of the most important parts is we're here to help.